My philosophy has always been that I could treat sinuses best by using procedures to help the patients more permanently, and that's why I went into surgery in the first place. And for years now that I've been practicing, I find that if you saw 100 patients, say with sinus issues, nasal and sinus issues, possibly 50 of those patients you can handle medically, and then 50 you would offer a procedure to. A lot of times only maybe 10 of those people were severe enough that they really had to go to the operating room. The other 40 patients or so, you would offer them a procedure, but previously it was only offered in the operating room, and you'd find that maybe only another 5 or 10 of those people would actually want to go to the operating room, and so you'd have about 30 people of those original 50 that sort of don't get treated. They're not really a good candidate to continue on medication, but they're not wanting to go to the operating room. So now office-based procedures have filled that gap. We're able to safely and effectively offer these procedures to those people. And so it's still maybe only 10 out of those 50 people need to go to the operating room. The other 40 will choose an office-based procedure, but you'll treat everybody because basically everyone will ultimately, for the most part, will go to having something done if you can supplement your OR procedures with office procedures. And that's where I've felt that as my practice has evolved, I've realized there's more and more that I can do, whereas previously I used to think, well, certain things had to be done in the operating room, but now I've gotten to the point where there's very few things that have to absolutely need the operating room. And so that's why I think I used to maybe do 90% of my procedures in the operating room, and now it's flip-flopped. I do maybe 10% of my procedures in the operating room on the nose and sinuses.